The laparoscopic Vecchietti is a surgical way to lengthen the vagina. The surgery is done in an operating room. First, the anesthesia team places an epidural tube in your back so they can provide pain medications to help with pain control during the post-surgery time in the hospital. Next, you will be given anesthesia, and a diagnostic laparoscopy is done. Diagnostic laparoscopy allows the surgeon to look inside the belly, known as the abdomen, and the pelvis through small cuts called incisions. First, air is put into the abdomen so the instruments have room to move during the surgery. Next, a camera is put in one of the cuts to see inside the abdomen. The ovaries and the uterine remnants are seen. A tube called a Foley catheter is used to keep the bladder empty during the surgery. Next, a suture is attached to an olive dilator and put into the abdomen through the vaginal canal. A camera is used to look inside the bladder to make sure nothing is seen inside the bladder. The suture is guided between the abdominal wall and the tissue lining the abdomen. The suture is brought out through the skin on the abdomen. Laparoscopic instruments are then removed. The small skin cuts are closed with a suture. Finally, a traction device is placed onto the abdomen and the sutures are attached to the device. As the sutures are pulled, the olive dilator is positioned against the vaginal opening. The traction device is adjusted to keep the olive dilator in place against the lower vaginal canal. At this point, surgery is now complete. You will be woken up from anesthesia. You will stay in the hospital with us for about 7 days. During this time, you must lay flat in bed as the dilator is tightened every day. During this time, the epidural and Foley catheter tubes remain in place to provide pain control and to drain urine from the bladder during your recovery. Once the vaginal canal is lengthened to about 8 to 10 centimeters, you will go back to the operating room for an exam under anesthesia. During this time, the traction device is removed. The small olive dilator is removed from the vaginal canal and replaced with a removable dilator. This is kept in place while the tissue lining the vaginal canal heals. During the recovery after surgery, the vaginal canal is examined using a speculum. The time the wearable dilator must stay in place is slowly lowered over several weeks. Often, a medication called silver nitrate is put on by your surgeon during the vaginal canal exam to help the tissue heal. At about 6 to 12 weeks after the first surgery, the vaginal canal is typically healed. After the recovery from surgery, if needed, dilators are then used to keep the vaginal length.